Well, do you ever wonder what happens to the leftovers you don't eat at a restaurant or cafeteria?
Brady Mallory has the answer to that, at least for SSM Health Monroe Hospital. Brady?
Yeah, you may think a hospital's only function is to help the sick, but many of them try to address other community needs. In this case, SSM and its head chef are using food as a medicine to help cure local hunger in Monroe.
So today was
When you're in Michelle Vine's cafeteria, you won't be hungry.
So we did a Kahlua-style pulled pork sandwiches that had coleslaw and homemade barbecue sauce.
The head chef at SSM Health Monroe Hospital knows the value of food.
So last week was our employee meal.
And after the employees are fed, she works to make sure the leftovers don't go to waste.
We've got some burgers and some veggie burgers, some buns and stuff that was left over from that.
It's all frozen for a heartwarming mission.
And package it up, label it for food pantry, and send it on over.
For more than 20 years, this hospital continues to donate leftover food to the Greene County Food Pantry.
It's all pre-cooked, easy stuff that people can just like pop in the microwave. Very well received.
Instead of ending up in the trash, Vine says she's glad the extra meals are going on tables that need them.
Food insecurity is a big issue everywhere across the world, of course, but this just gives us an opportunity to be able to give back to our community as well.
Feeding America says food insecurity rates affect rural areas more than urban areas and found 9 out of 10 counties with the highest food insecurity rates are rural. Campbell says he sees a growing need in Greene County with more people utilizing the food pantry.
The food gets used. It's very easy to find a need. Having something consistent like SSM giving us a bunch of stuff has been very, very, very useful.
Vine says this work fits in with the hospital's overall mission of healing.
There is research that actually shows that people that are dealing with food insecurity, their health themselves is actually quite poor because they have to choose between getting the help that they need for their health or food. And lots of times, especially if it's with a family with children, they're going to choose the food and not that health care.
Whether it's at the hospital or at the food pantry, head chef Michelle Vines wants to make sure people are fed. Kindness is always on her menu. And who isn't hungry for more of that?
And if you're not going to use it, see if there's somebody that could use it.
And Vine says the donations mean up to 40 meals per month for the food pantry there.
It's an amazing idea.
Yeah, great idea.
How long have they been doing it?
For more than 20 years now.
That's incredible.
Yeah. And I think it's a big reminder to all of us that if you don't need something, someone else can use it.
Always.
So, yeah.
Yeah.
Recycle.
Good for them.
Reuse. All right. Thank you, Brady.
Thank you, Brady.